After 18 months of research, which included surveys of formerly incarcerated folks and their loved ones, interviews with formerly incarcerated folks, interviews with correctional leadership and correctional staff in a number of different states, site visits to several different states, consulting with experts in nutrition and public health and law, talking with folks who are transforming the food in other sectors like hospitals and schools, we were able to condense all of that into the first national investigation of prison food. It's a lot of information. It's a very long report, so I'm just going to share a few key takeaways today, but I hope you'll continue to take a look if you find this interesting. So high-level takeaway number one, prison food generally sends a message that the people who are eating it don't matter. So stepping back a little bit, and looking at food, I'm coming at this from the perspective of a folklorist and ethnographer, and looking at it from that perspective, what and how we eat impacts every aspect of who we are. Food is something that really blurs the line between our cultural selves and our biological selves. We have to eat to survive, but yet as humans, we really imbue food with a deeper meaning in both explicit and really subtle ways. And food connects us all to people, to places, to seasons, to the rhythms of daily life. We use food to communicate identity and relationships and values, and none of that changes just because someone is incarcerated. And if you look at the typical prison food experience, it's degrading, it's dehumanizing. In many facilities, food arrives actually marked in boxes not fit for human consumption. And all of that sends the message that the people who are eating it don't matter. Key takeaway number two, low standards are sacrificing health and dignity for lower cost or lowest cost and highest efficiency. The quality of prison food varies. There are some places that are a little better than others, but nationwide, the patterns are pretty clear. The typical prison diet is unhealthy, it's unappealing, the food is sometimes unsafe. It's usually very high in sodium, sugar, refined carbohydrates, very low in critical nutrients, very low in fresh fruits and vegetables, fiber, quality protein. Basically, it's the diet that we've all been told for the last several decades that we should be avoiding. And this system is incentivizing these meals that actually harm people, not just while they're incarcerated, but also for a long time after the sentence has been served. And the third key takeaway, there's really a critical need for more transparency and accountability. So in many facilities, the inspections of the kitchen and the eating areas are internal. They're not necessarily from an external entity like a Department of Health. The inspections that do happen are usually announced, so facilities often have time to do a quick cleanup in advance. Also, prisons are just notoriously opaque institutions. It's really hard to get a lot of information out of them. And there's not just a lack of official accountability, but also a lack of the public making people accountable. And we'll talk a little bit more about that later as well. So as I mentioned, the typical prison diet isn't particularly healthy. Most agencies will tell you that their menus are dietitian created and approved. That doesn't always mean what you think it does. So we heard from several correctional dietitians while we were doing our research that their job was really to make sure that the meals that were being served fit in with whatever the state's nutritional guidelines are, which can be very vague. It doesn't mean that the dietitian has actually designed a diet that they think is healthy from their professional perspective. So you can see here that compared to a typical My Plate, a typical prison tray, it does not really meet those guidelines of half the plate being full of fruits and vegetables. Many correctional dietitians have told us that while the meals meet the recommended daily intakes of basic nutrients and they might meet a certain level of calories, there's not necessarily the quantity or quality of food that actually will keep people full. 94% of people who took our survey told us that they did not have enough food while they were incarcerated to feel full. Some reported short and long-term impacts from people who took our survey or people we interviewed, both physical and mental. So you can see that the diet often leads to the things that we would normally associate with a poor diet, like diabetes, hypertension, heart disease, high cholesterol. But it's not just the physical impact of food. The research has shown that there are certain micronutrients that when people are deficient, they actually are impaired in terms of their mental health. So it can not only cause things like brain fog or depression, but also actually aggravate aggressive and hostile behavior or even impaired decision making. So it's not just the food that's being served that contributes to all of these health impacts, but also the eating environment. And I often tell people to stop and think for a moment about how you feel in different eating environments and how that mental state, that emotional state impacts not just the way that you're enjoying your meal, but also how you feel in your body. So a prison chow hall, as you can see in this picture here, is very often crowded. It can be very loud. It can feel unsafe. People don't always have a choice of where to sit. It's very rush. People are sort of herded in. You grab your meal. You often have maybe 5 minutes to sit down and eat. All of that actually impacts the way that your body processes food. So when you're eating quickly, or when you have potentially correctional officers standing over you, yelling at you to hurry up, that can cause a physiological fight or flight response in your body, which can actually, again, provoke like excess awareness and make people more likely to misinterpret social cues as hostility and therefore make people respond to that in a more hostile way. So it actually makes everything less safe. There's also some really interesting research out there that shows that other factors like natural light or sound or timing of meals, that many correctional facilities serve meals very, very early. Dinner finishes at 4:30 or so in the afternoon. Breakfast could be served, we heard, as early as 3:30 in the morning in some facilities. All of those things like light and sound and schedule actually also impact the way that your body processes food. For those who are eating in cells, in addition to a chow hall, that's also a really unpleasant environment. And we generally associate food with environments that are supposed to be social and nourishing. Something else that's really important to consider is to bring in a trauma informed approach. And I know that this has become more common in places like schools. And I saw that there's actually a session for the summit about looking at trauma in food in schools. But it's not really being considered in the correctional environment. So, a huge number of people who are incarcerated have experienced trauma. And trauma can come from what Leah's Pantry, which is an organization based in Southern California that does a lot of work around food and trauma. They call adverse childhood or community experiences, or ACEs. ACEs are often just referred to as adverse childhood experiences, but you don't have to be a child to have experienced trauma. You can experience trauma as an adult. So these could be things that happen in your household, in your community, or in your environment that not only impact you psychologically, but also have a physiological response in your body. And Leah's Pantry uses this metaphor of a house to really explain how this impacts you. So when you've experienced trauma, it builds up toxic stress in your body. And that can be directly food related trauma, like having experienced food insecurity, or manipulation or abuse through food. Or it can just be trauma in general, but that disrupts your neurodevelopment and it can damage your metabolism. It can cause inflammation. It can disrupt the way that your gut and your brain work together, which in turn has social and emotional and cognitive impacts, which in turn causes people to adopt certain behaviors or coping strategies, which aren't necessarily healthy, which again leads to further disease or health problems, which can cause early death. And it's important to note also that when people are caught somewhere in this cycle, then they can also perpetuate those same patterns for children if people are working if people are living in families. And so then those children are experiencing, again, starting from the level of ACEs and toxic stress, and it disrupts their physiological and psychological responses and their relationship with food as well. And for many people, a coping strategy for experiencing trauma might be using substances. About 85% of people who are incarcerated are struggling with substance use. And substance use actually also impacts the way that people process food. It can affect the absorption of nutrients. It can increase cravings for sugar and other refined foods. And a typical prison diet is actually feeding that cycle rather than interrupting it and starting a newer and healthier beginning. So when we're talking about the overall eating experience in prison, there are so many points of intervention. And one of the things that, I think is really important to note is that the sense of how are we addressing the inhumanity of the carceral system as a whole, how are we addressing this issue of mass incarceration, can feel really overwhelming. But when we stop and look at food as a tool for exploring health and humanity, and when we stop and look at food as something that we can do something about, we see there are many different points of intervention, using food to really talk about mass incarceration, what it's doing to people, what it's doing to our families and to our communities.